Hi, my name is Dr. Doug Olson. I'm an orthopedic surgeon in Maumee, Ohio. If you're watching this video, then you've already met me in the office, and we have discussed that you need an upcoming carpal tunnel release surgery. I made this video, as well as others, about other procedures so that patients can watch this and understand what to expect with their upcoming surgery and what to expect after surgery. And basically, it's a frequently asked questions video that other patients have asked. First, to reiterate, carpal tunnel syndrome is a syndrome where you have a pinched nerve at your wrist. The nerve starts in your neck and comes all the way down your arm, and then there's an actual tunnel that is compressing that nerve. And people have different symptoms with carpal tunnel syndrome, but in general they experience pain, numbness, tingling, cramping, all throughout the hand, typically more on the thumb side of the hand, but it can really be all throughout the hand. And if you, again, are watching this video, then the non-operative options either weren't an option for you because of your symptoms, or you've tried them and they did not give you complete relief. With an upcoming carpal tunnel surgery, you'll show up the day of surgery, and we either do this surgery under local anesthetic, where we just numb that area of the skin up and we don't sedate you, or we do sedate you, giving you some relaxing medicine. This would have been discussed with you in the office, and that has already been decided. In surgery, you have a small incision on this side of your wrist, and we go down and I release the tight band of that tunnel and open up the tunnel. So basically, I always tell patients that carpal tunnel syndrome is like you're trying to water your flowers while you're standing on the garden hose. And in surgery, it's like we take your foot off the garden hose. Now that nerve can get the electrical stimulus that it needs through. After that, we close the skin up. Typically, all of the stitches are underneath the skin and the skin is glued shut. Occasionally, sometimes I have to put stitches on top of the skin that we then take out when you come to the office. You'll have a soft bandage on your hand. Typically, you leave that on for a couple days and then can shower, and then can place a Band-Aid over that incision each day. If there's anything different, I will have instructed you or your family member after surgery. After the surgery, you can use that hand for light activities like eating, drinking, brushing your teeth. I don't want you to do any heavy gripping or any heavy lifting. You really need to take it easy with that hand. You see me 2 weeks after surgery, and at that point we can start increasing your activity. Most people have a significant relief of their symptoms almost right away within the first few days. If your carpal tunnel syndrome has been present for a long time prior to surgery, it does take longer for that nerve to recover after surgery. Most patients have some pain in this area of their hand for about 6 weeks after surgery. After the 2-week mark after surgery, typically you can start increasing your activities, although you will have some discomfort, particularly with gripping and lifting. But you pay attention to your symptoms, and that will dictate how active you can be. I certainly hope you found this video helpful, and if you still have other questions or concerns, please call my office at 419-893-2663 at Westside Orthopedics at St. Luke's Hospital.